Hi, good morning. My name is Dr. Raja Adnan Ahmed, and I am a psychiatrist working in UK. And this morning, I got Dr. Yawar Yaseen with me, and this is an interview around career pathway in hematology, and we will discuss how Yawar secured his training in hematology, ST training in hematology, and what was the requirement and how he went through that journey. But I think I'd just like to thank Yawar first for doing this. He's currently working in as an acute medicine registrar in Stoke-on-Trent, and from August 2022, he secured both ST training in acute medicine and also in hematology. So I thought hematology is one of those fields which a lot of IMGs talk about, think about, but they might not know how to get into that. They might not know what is the recruitment process and how difficult it is. So I thought this video will be helpful for those particular IMGs. First, I'd like to thank Yawar, and Yawar, thank you very much for joining. And would you like to share your journey so far as an IMG? What have you done so far to get to this point?
Thank you, Dr. Adnan, for having me. Thank you very much. And once again, thank you for the brilliant effort that you are putting in for doing these videos, which personally I found very helpful during my interview preparation. I have basically graduated I'm from Jammu and Kashmir in India, and I belong to Srinagar. I've graduated from Jammu in year 2008. After that, I pursued my master's in medicine from Srinagar Medical GMC Government Medical College Srinagar, which was a 3 years course. It's something similar to what our colleagues from Pakistan do as FCPS in medicine. So it's a 3 years, but I think in Pakistan it might be for 5 years. And my interest in personally in hematology was because my mother, she suffered from myelofibrosis, and ultimately she succumbed to complications because of that. So this was the triggering point why I chose hematology as a specialty. Besides, I found that during those days there were very less hematologists in Kashmir. Her diagnosis was a little bit delayed, and that intrigued me as to why people are not trying to go into hematology as a specialty. I realized in India there are very few hospitals which actually help you in getting a fellowship in hematology. In fact, I did go to one of the leading hospitals in India, Christian Medical College, Vellore, which is the largest hematology center in India, running a very good bone marrow transplant program. Uh, Unfortunately, due to some reasons, I couldn't secure a fellowship there. The year I went, they stopped taking fellows because the interview and admission process was somehow changed by the government. But I think Allah had other plans for me. I didn't get discouraged. I came back and I went for a couple of years to Saudi Arabia, Gulf. I worked there as an accident emergency registrar. But my ultimate target was to come to UK. I wanted to use it as a route to be here in UK because this I found would have been another place where I could pursue my long-term passion and the goal of becoming a hematologist. And Alhamdulillah, it was a dream come true. I secured my training number here. But journey was not easy. I have been alone here. My wife is in India along with my kid. She had to struggle and she made her sacrifices. I'm thankful to her and the rest of my family. Personally, also, I was alone here. At times, I did feel low, depressed. I was in a new place. I was missing my family, my wife, my kid. But ultimately, I think these are things that are a part of a struggle, and ultimately, the end result is what you get, whether you get your target or not. Alhamdulillah, I was fortunate to get what I wanted, and I secured a training number in hematology. And inshallah, I'll be joining in August in University College Hospital, London, as a
No,
hematology trainee.
thank you for sharing your journey. I think you're right. If, a lot of IMGs go through a lot of struggle, personal sacrifices, and a period of loneliness. Is again, it's not uncommon from the IMGs initially to go through that struggle period. I wanted to ask you, especially, what are the requirements to apply for hematology? I understand this is part of allied medicine field, so you have to do MRCP and uh, either the core medical training used to be the past, IMT. Is that right?
So I think this year they have changed the recruitment a little bit. They have divided specialties into two groups, Group 1 and Group 2. I think this has happened for the first time. I thought they didn't have interviews for Group 1 in round 2. But in round one this year, there were specific categorizations of specialties into group one and group two. Group two includes specialties which basically you can apply at an ST3 level. So it includes specialties like clinical oncology, hematology is one of them, dermatology is one of them, audiovestibular medicine, aviation medicine, sports medicine. There are some specialties, but not many. Main specialties which the IMGs focus on, they are in group one, but you have to apply at an ST4 level. So your competencies and the requirements for that are different. Basically, through hematology, you can apply as I applied. I initially came to UK as an MTI on an MTI initiative to work in the University Hospital Midland as an acute medicine registrar. I couldn't go through the IMT pathway. I had to choose the alternative pathway and get my core competency signed off through my consultants and my education supervisor, which I'm thankful to them, which they helped me in getting signed off. For both groups, you need different specialty for different competencies. For ST3, the requirements are lesser. For ST4, the requirements are more, like the number of patients which you have seen. For ST4, applying for group one, you need to have some experience in ITU as well as geriatrics. But for ST3, the requirement is not there in the form, which we have to get signed off. So yes, you are recruited at an ST3 level in hematology. The interview process is conducted by Health Education England, same process. Although the questions that they ask in ST4 and ST3 recruitment are quite different, which I realized because I applied for both the specialties in this interview. I applied for acute medicine, for which recruitment was ST4, and for hematology, for which the recruitment level was ST3. The other important thing this year is that PACES was not a requirement for getting into ST3 specialty. However, for ST4, either you needed to have PACES or you should have PACES before joining the specialty. So some of my colleagues, which I know have secured a number in ST4 specialties like cardiology, gastroenterology, renal, they have to have their PACES passed before joining. But since I came here, I have yet to appear in my PACES. I couldn't get a PACES slot. So, but I can join the training. But during first year of my training, I can complete my PACES, which hopefully I've got a date now. I'll be appearing for the PACES. So yes, this is the gross change that they have made. Earlier, all the specialties were recruited at ST3 level, but now they have changed it into group one and group two. Group one, that includes renal, cardio, gastro, acute medicine, most of the specialties which are IMGs are interested in. But yes, I was personally interested in hematology, so it comes in group two, so you're recruited at an ST3 level.
Thank you for that. So the recruitment process itself, what was it like? So when did the application open, and what was it like for you to apply, and what were the requirement? Requirement, I think you've already mentioned, but as you mentioned, this is a centrally recruited specialty. So your application were all going in one Oriel. Is it via the Oriel you were applying?
Yes. So it's via Oriel. So as I told you, I applied through the alternate competency. Some of our colleagues, like who are IMTs, they do IMT1, IMT2, and then IMT3. So for them, they have to apply through that route. But all of them come to a single point where an interview is conducted for either ST3 or ST4 that I already mentioned. It's through Oriel. But I think the process of preparing for the interview should start much before then the application actually opens. It's not difficult. Initially, when I came here, fortunately, alhamdulillah, I made good friends and colleagues who were in training, and they guided me very well. Some of them were from Pakistan, and I'm really thankful to them. They opened my eyes. I remember a colleague of mine saying that you should open the requirement every day morning and revise it, and every day try to do something that brings you closer to a good score. So yes, the application basically this year, I think it opened in November and closed in December for interviews that were conducted over January to April. So different specialties have interviews on different dates, and however, the shortlisting, which is done by the criteria which are used, are same for all. So I'd like to mention that there are different domains which you have to fulfill while applying, and you are scored on that. Personally, when I came here, I thought I'll not be able to score anything. But then when I spoke to my colleagues, I realized that I already have done many things which I can use as a part of the recruitment process. So it requires a little bit of guidance, especially when you are new here. in a new country, you might be thinking, oh, they might need a lot of things to be done. But actually, I realized most of the things we have already done back in our country. So there are different domains. One domain is you are scored on your undergraduate, any additional undergraduate degree which you have done in addition to the masters in medicine. I found most of the people don't have it, but yes, some of my colleagues from Pakistan, they I am not sure is it still going on there. They do some undergraduate in any other subject while pursuing their masters in medicine. In India, I'm not sure anyone does like that. That is scored upon. I hadn't anything for that, so I simply got a zero for that. But then I worked upon other aspects. So they do score you for your postgraduate qualification, like a PhD or a master's or an MSc, if you have. Fortunately, I had done a master's in medicine, which was a research-based subject, and I had some clinical attachment. So I claimed full marks for that, and they did give me full marks for that. Prizes, yes, if you have been illustrious through your medical career, if you have a distinction, gold medal, or if you have any honors during your undergraduation or post-graduation, you can claim it. I had I had won an award in a presentation, so I claimed it gave me only 2 marks, but that also was helpful. Then teaching. So for me, I like to mention that yes, I did spend a lot of time working in India initially as a postgraduate, then as a registrar. So for me, it was easy to claim those points because as postgraduates, we are encouraged to arrange classes and do teaching there. So I did get evidence from there. One more thing I'd like to mention here is because this country is so fair, they accept all the evidence that you get from your home country, provided it's correct. This I really appreciated, which these things might not be true in our countries because we get evidence from some other, we might have to prove it or show whether it is correct or not. Saying that, but I will also like to say that yes, they do verify at their own level whether this evidence is correct or not. Why I'm saying this? Because one of my colleagues had got a feedback and they had gone to the FCPS site to actually check what he had claimed. Is it true? Like the duration and all those things. So don't be under an impression that I'll claim anything and no one will check it. Be very careful. Whatever you are claiming, it should be correct, and you should be able to produce an evidence at any point if asked for, because otherwise it will be counterproductive. You may be probed, and like I can imagine only what things that complications might happen. So yes, teaching. There are two components in teaching. One is whether you have actually personally been involved in creating a roster or a rota of teaching. That gives you the highest marks, 6. Below that is if you have been involved in teaching, like given some teaching lectures over a period of time, like 3 months or 6 months. That gives you lower marks. And I think also the other component of teaching is whether you have any qualification in teaching, like have you done a master's in teaching, which I'm sure, like in our profession, many people, especially from the subcontinent, don't have that. So the lowest score is 2, which you can claim is by doing a teaching course, which can be over 2 days. So there are many courses that are run, like by Oxford Academy. They do a two-day teaching course, and fortunately, these days courses are online, so you don't have to physically go there. But they give you an evidence that yes, he had participated in our teaching session and teaching course, and that helps you to secure those 2 points. Then other aspect is leadership. As I already mentioned, I had worked in India, like in Kashmir, for a lot of time. So it did give me some time to develop my leadership skills as I was working in a hospital and I was in charge of that hospital, running some national programs there and all that. So I claimed it that way. So yes, they agreed and they gave me the full marks for that. But yes, there are different ways in which you can show your leadership, even simply like managing a rota at your hospital, volunteering for doing a rota of your colleagues, or if you are at a registrar level, doing a rota for your juniors. That again counts as leadership. I even like did help my department to establish procedures trolley. So even that can be claimed as a leadership. So anything that you think helps yourself to develop your skills as a leader, you can claim it. Don't overclaim it, but claim it, and definitely they will appreciate it if they consider it fits their criteria. Audit, yes, audit experience. Again, in our subcontinent, we don't have that much exposure to audits, to tell you frankly. We do a lot of research. in our subcontinent, but audit is a different concept which I was not aware of. So initially, when you come here, try to understand what an audit is, what a quality improvement process is, what are the differences between the two, and what is the significance of it. Initially, because I was in acute medicine, so I did an audit related to acute medicine. It can be a simple audit. It doesn't need to be a very complicated or a complex one. But yes, it should have some meaningful purpose that why you are doing. And most importantly, you should be able to understand that what was the importance and significance of this audit, because these things might be asked in your interview. One more important thing I would like to say, this audit doesn't necessarily need to be related to the specialty you are applying. It can be any audit. So don't be worried that, okay, it's not in hematology. As my audit, it was not related to hematology, but yes, it was a medicine related audit. It was for checking the compliance of medical reconciliation forms. So yeah, it's important, and it helped me to fetch 6 marks. Publications, I would agree, is a little bit difficult for IMGs, especially who are coming immediately after completing their graduation into UK. But there are so many things happening here. You can join some consultant or a registrar who you think is oriented, academic oriented, and is doing publication. You can volunteer and tell them, okay, if you are doing this project, I want to be a part of it. And if even if it gets published and your name is not the first author, it can be a co-author. It will help you to gain marks. For me, to tell you personally, because I had worked a lot in India, so I had already an advantage. So I had some PubMed index publications. In UK, yes, many of the hospitals and trusts are linked to BMJ. So they have easy access for getting publications done in BMG, which is a PubMed index journal. I would tell my colleagues and IMGs that they should get involved in some part of publication at a point during their IMG training. As I told you, there are so many things happening. You can join a project that is already going on, or you can go with an idea to a consultant or a registrar. Or if you see, even if you see a rare case, like a case report, go to your senior if you are not confident in knowing how to apply to a journal for publishing. Definitely, they will guide you. They will be happy to assist you in that and publish it. Even if it is not getting published in a PubMed index journal, publish it anywhere, at least to give you your 2 marks to apply for, and you'll not get a 0 on that station. All said and done, I know it's a bit difficult, but for IMTs, for who are doing IMT 1, 2, and 3, they will definitely get a chance at some point in their career to do a publication. Then the presentation. Yes, presentations, as you know, because of COVID, most of the presentations are not happening face to face. So before you even if the presentation was happening at some place in Sri Lanka or India or Spain or somewhere, you had to go physically there. The advantage these days is you just apply and it's online. So for that, you should have some material to present. Again, if you are doing some publication, if it is novel, or if you have done a very good audit, which you think is presentable at a conference, apply for it. You have to pay a fees. They will screen and they will assess whether this material is presentable at their conference, and you can claim marks for that. That will give you the highest 8 marks. If that's not working, look at your Royal College. They are always coming up with various conferences like the SAM, Society of Acute Medicine, and various other societies that are giving you an opportunity to highlight your publication. It can be a national conference. If that's not working, present a poster. If that's not working, then present anything at your trust level. So even that gives you 2 marks. So don't let it go 0. Do something. There are so many aspects which you can take, so many aspects which you can fulfill and get at least a minimum score if you're not getting the highest. Yes, these are the various indices which they use for marking your application and shortlisting you. What I personally observed this year is I didn't know of any person who was not called for an interview. So I think the score is out of 58, and I secured 45. But I even know of people who had their score in 20s and they were called for interview and they did get a training number. This is the reason is because this aspect is a very small part of your selection process. one, it is multiplied by 0.35. So the difference that actually ends up is very small. So for example, if I was getting 46 and other candidate was getting 25, the actual difference will be 3 or 4 marks, which you can very easily compensate in the interview process. Again, as I told you, this year I'm not sure. I can't be sure. Only if they come out with the data, we'll be able to know. But I don't know of any person who was not called for an interview. Even people who had their score in 20s, they were called for an interview. It may vary from specialty to specialty, but I'm not sure. They might have reduced the actual numbers required for shortlisting the candidates. Maybe they wanted more people to come in for the interview so that they can scrutinize more people and find the best people they want. But yes, it might be a good news for many. But I would say work on your this requirement of marks. It is important, but it is not everything. The interview and the process that you enter later on, that's the most important thing. This helps you to go to an interview, but definitely you'll have to prepare for your interview well. So that's the important criteria. Again, I would like to share a personal experience. I had applied for round 2 last year in hematology. I had done audit, but it gave me less marks. So I did a recycle and I got more marks. I didn't have an international publication. I didn't have an international presentation at that time. So again, I submitted my research in an international conference. Fortunately, they accepted it. It was an online one. I gave my presentation for 10, 15 minutes and it fetched me 7 marks. So keep on trying to improve your score all the time. Though again, I would impress that it's not the only thing. It is a part of it, but it's not everything. The main part is your interview. So yes, this I wanted to share and let the IMGs and IMTs know that how it works.
Thank you for sharing your experience. So this is as you explained, when you're applying for the hematology, then you have to as part of your application process, you have to give all this evidence of things you have done, and then this is that a self marking, and then they will check against you the evidence you give them. Is that how it works?
So yes, they you have to for these things you do have to upload the evidence as well. Like you should have a certificate from the organizing
Yeah.
committee of a conference. You should have a certificate from someone in your medical college back in India or Pakistan who will confirm that yes, he had done a teaching.
Mm.
And preferably it should contain the correspondence number and correspondence email of that person so that they get a chance to verify. Otherwise, maybe they doubt that whether it is correct or not. This
Okay.
year, again, one more thing was added commitment to specialty. So they did check for commitment to specialty before they actually conducted your interview. What used to happen previous years is that they used to simply ask you in the interview about the commitment to specialty, but they did check on your commitment to specialty even before the interview. For those things, uh, you have to mention whatever you have done in that specialty. So different specialties, some specialties did mark you for commitment to specialty before the interview, but some specialties didn't. Like I think neurology didn't have any commitment to specialty, but hematology, acute medicine, yes, they gave you commitment to specialty score. But at the same time, they mentioned that your commitment to specialty will be checked again at the time of interview, and that will be taken as a score uh, for your for your acquirement of a training number. Uh, I know some of my colleagues who had secured zero on commitment to specialty and they were invited to the interview. I think commitment to specialty score, again, they use as a criteria whether the patient is, oh, sorry, whether the person is interviewable or not. Because people who had got commitment to specialty around about 8 marks out of 20, they were called. But as I told you, some of my colleagues, I know they had got zero. So
Yeah.
even if they had a score very high in the pre-interview shortlisting score, they were not called for the commitment to specialty. In that, they use the ORIEL, again, the information that you have provided on ORIEL,
Yeah.
what you have done in that specialty, have you worked in that specialty, have you done any audits, have you done any publication, have you attended any clinics in that specialty. Obviously, IMTs who are here, they do have an edge. They are definitely at an advantage compared to us because they run through the process. They are rotated through the specialty
Yeah.
postings. So they can prove their commitment to specialty. They have a 6-month posting.
If somebody, as you said, if somebody has done a post in hematology, it's easier. They must have done a lot of things during that post, and there's got a lot of opportunities. But if somebody hasn't got a hematology rotation and hasn't got experience, what can they do while even working in their home country or even here in UK if they are on acute medicine post forever? What can they do to show that they are committed to hematology?
This is a very important question, Adnan Bhai, because for me, the situation is a little bit similar. I was working in acute medicine, but I had to somehow prove that I'm committed to hematology here in UK as well. Many things one can do. So I was lucky to work in a very good hospital, which has a very good hematology department. And I went to the consultants. People here are really helpful. I'm really thankful to the hematology department here. They encouraged me to come, join their rounds. I even went to the bone marrow clinics there. Uh, they were even offering me if I want to do some publications with them. I definitely wanted to do, but as I told you, I had some publications from India. So I was focusing on the interview and other things. Uh, Other important things you can do is attend conferences. So joining British Society of Hematology was a real boon for me. I joined British Society of Hematology. It just costs you £70 as a, if you claim as a student or something for a year. It not only proves your commitment to specialty, but it has various list of conferences which are free. And as I told you, luckily most of the conferences these days are online, so you don't need to go there. You attend them, they will give you attendance certificate, and that really helps you in your commitment to specialty. Because when I saw the feedback that I was given by the interview, they had really appreciated it, and they had said that despite being in acute medicine, he has still showed interest by attending various conferences. There are some paid conferences and paid seminars. One is very important, which is done by British Society of Hematology, that is for IMT Day. So various IMTs on that day, they try to encourage them in joining hematology, and they tell you about good aspects of hematology. They discuss some cases. I also attended some BSH conferences live, which were actually done. I went personally there. As I told you, it's all how much you are interested and how much extra effort you want to put. It's not easy. So I used to go to attend rounds on weekends, on Saturdays and Sundays, which I was off, go to the hematology department. They were really welcoming. I made friends with some registrars. They gave me insight into knowing what hematology is like, because that's very important to understand how the specialty is working in UK. It might be working at a different level in your own country, but how it's working in the NHS, it's very important. You need to have that insight, and that will give you the confidence while you are going into the interview. I think that helped me. That really helped me. I spoke to consultants. They told me, they groomed me a little bit. They told me that how the interview works. They even made me confident. They told me, yes, you know about hematology. You just need to be calm and cool at the time of the interview, and how to approach the questions that they ask you. So this can be very important. The other thing is, yes, again, as I told you, if you are in touch with the consultants of a particular specialty, they will tell you some projects that are going on. Join them, find extra time. Maybe it might be working after 5 with them, or on a weekend or something like that. But ultimately, that will help you in two ways. It will prove your commitment to specialty, and the other aspect is that it may help you to even gain marks on your shortlisting score. So yes, this way it is important. The other aspect is that being in acute medicine, as you know, acute medicine deals with variety of patients. So I was also involved with hematology patients, like we deal with thrombosis patients, PE patients, anticoagulation, and we do blood transfusion. And sometimes you pick up a hematological malignancy or a thrombocytopenia. So you develop interest, you speak to the fellow colleagues in that particular specialty, make friends with them, and even mention that I had mentioned it that although I'm working in acute medicine, but this is the only specialty which could have brought me closest to the specialty I love, that is hematology. So it again proves that you are committed to that specialty and you are putting your energy and focus on that. And I think people really appreciate it, that if you spend a little bit extra time and extra effort in doing something in a particular specialty, they do appreciate it really. And I felt that yes, they had mentioned in my feedback that he has a vast experience of medicine, but still he's interested in hematology. Because I feel what they at the end of the day want is not only a good specialist, they want a good internist as well.
Yeah.
So you should have a background knowledge of medicine in both. It's not like as they've asked me in a question in commitment specialty. So as I told them, like you do a CVC of a patient, the actual problem might not be in the bone marrow. It might be that patient is having polycythemia because he's a smoker. So you don't start evaluating him for polycythemia vera when he knows that. So this is what they actually want. They want you to be a good internist, but yes, they want to train you as a specialist by seeing that whether you have that commitment to specialty, which again you can prove, as I told you, by joining the societies and getting in touch with the consultants in your hospital who are in that particular specialty. So I felt it's not the only end of the world if you're not working in that specialty in UK. But if you have shown some interest in India, as I told you, I showed to them that I worked in a hematology center in India, and it was because of my desire to become a hematologist that I went to that place. And I have done some publications in India. That also counts as a commitment to specialty. Doesn't matter if it's not done in UK.
And the other question I was going to ask you about the recruitment experience. You said about the application process, the shortlisting. So what was the interview was like itself? Was there different stations, and then when you called for interview, was it online? How did it work?
Yes. So that is the main thing. When you are shortlisted, you are invited for an interview. So I appeared for the interview twice. Once I appeared in for an interview in Ireland. So in round two, when I appeared, to tell you frankly, Adnan bhai, when we appear for interviews in India, like the interviews are totally different. So I was preparing for hematology fellowship in India, and what we would expect is they would ask us rarest of rare things, like a very rare complication of a drug, or the dose of a drug, or a latest research they would ask us about. So when I appeared for my first interview in round two in hematology, so I was preparing on those lines. I was reading latest research articles and something like that. But actually, when I appeared in the interview, they asked me something very basic and uh, something I wasn't very well prepared, and I didn't get selected in round two. And then I realized actually what they want. So they don't want your knowledge to be very high. They just want you to have a basic knowledge of that specialty. And that's what the interview process is about. They want you to be a very safe doctor. So there are four stations in hematology interview. As I told you, they recruit you at ST3 level. This year for ST4 recruitment, they had a special station that was registrar suitability. That doesn't apply to group 2 specialties, that is hematology. So it includes total 100 marks, out of which 20, as I told you, are for pre-interview score.
Yeah.
And the remaining 80 are for the interview per se. So first station is they ask you the commitment to specialty. Yes. So they will ask you all what you have mentioned in your oral application form, all what you have done till date. But you have to remember one thing is important. It's a very tricky game. So you will have to prepare. It's only 5 minutes that you have to speak everything about it. So it's not that you have filled the oral form and next day you'll go and go sit up in the interview. You have to know what you have to tell them, and within 5 minutes. So you might have written so many things in oral, but you have to prepare the interview for 5 minutes. So it will require a little bit of rehearsal, a little bit of practice, and you have to tell them the most striking points and most important points. So obviously they will ask you, what's your commitment to specialty? What have you done till now to become a hematologist? Or why do you like hematology? Questions like these. You have to know what you will tell them, and you have to prepare well in advance for that. You might have to just brush upon what you have done. The other thing is, yes, if you have done something, they will ask you in detail. So know what you have told them already in the oral form. So for me, they did ask me about one of my research publications that I had done. And Alhamdulillah, I had done it about 7 or 8 years back. Hadn't I revised it, maybe I might have fumbled. So revise what you are telling them. For example, if you have a paper, if you have a case report that is published, know well why you did that case report, what impact it had, and how it changed your practice. So these things you should be very well versed. This is for the commitment to specialty. They scored me 9/10 for this. Possibly why I think is I didn't have a direct audit in hematology. As I told you, I didn't get that much time, and I wasn't possibly working in hematology here. But 9/10 is not bad. I'm really happy with that score as well. The second is a clinical scenario. As I again told you, it's not very high level or anything out of the world they will ask you. It's just basic hematology. They just want to see if you are a safe doctor. If you have an inclination towards hematology, they will immediately recognize that you are answering their questions as a budding hematologist, and you have an interest. It can be anything. It can be like any emergency in hematology, or they might show you any full blood count and tell you how will you approach it. Very simple. They won't expect you to speak like a consultant, but as IMT, and it's clearly written in the question that you are an IMT2. So you have to think like an IMT2. Don't expect that they will expect very high level answers. For preparation for the clinical, I used Oxford Handbook of Hematology. It it's a very small book, and you can study it, study some common scenarios from that. I did also use some online resources for some transfusion complications. There is the JPAC guidance. If you have time, you can read it. Again, the British Society of Hematology has very good resources. They have their guidelines. They might be a little bit elaborate, but you can go through some of the common hematological scenarios through the guidelines of British Society of Hematology. Uh, as I again told you, if you have worked in hematology here for 6 months, you will definitely have come across a scenario which they will ask you in the interview. So don't worry much about it, but yes, be prepared. At least know the basics of hematology. Like, for example, if they ask you a patient with tumor lysis, you should at least know what are the basic things you need to do in tumor lysis, like giving fluids or giving allopurinol, or when you will give the raspberry case, basic things you might ask. And then they start asking you, probing you a little bit more to see what level of knowledge you have. Again, they won't expect you to have a consultant level knowledge. So they will grade you. So there are different scores for each answer you give. 0 is like they will have a concern that your answer was not appropriate, and it's a concerning thing. Then the higher level is that, okay, you have answered, but it's not satisfactory, and they will like to see the other stations. The higher is that they will think, okay, you are equal to the level of an IMT2. Above that is they will mark you as an above average candidate, and 5 is excellent. So if you want to score more marks, yes, you need to tell them a little bit more, but it will be basic, not a very high level of knowledge you'll require to be having. And importantly, they will like to see whether you're a safe doctor. That aspect I realize is very important. Patient safety is the paramount importance. Patient concerns you have to address in your question. Yes, that's very important. So this is a clinical scenario. The other is the ethical scenario. So it will be any ethical question related to hematology. Like, for example, if you have missed giving a dose of delta current to a patient, or any complication that arises out of transfusion, or like scenarios which we usually practice in PACEs. So if you are preparing for PACEs, or you have already appeared in PACEs, the scenarios will be the principles involved in the scenario will be very simple. A duty of candor you should remember, and patient comfort, patient concern, these things you have to redress. And if there has been a drug error, then what will you do to redress that drug error, and things like that. GMC, good medical practice, I would recommend my colleagues to go through that and be well versed, because it is those principles which you will have to use in answering your questions, whatever scenario they may throw at you. Again, I would like to mention here that most of our colleagues read the Interview Preparation Handbook by Oliver Pickard. It's a very good book, but what I would recommend my colleagues, and what I also did, is that there are many examples mentioned in that. Don't always go by the examples that have been mentioned in the book. Think of what you have seen about those scenarios in your actual practice. Because when you think of that and when you reply, it's from your heart, and you won't do any mistake. And I personally felt that people who are conducting the interviews, they are experts. They can at once make out whether you are saying it out of your heart or you have just read it from somewhere in the book. Because if they ask you some other questions related to that scenario, you will be very confident in answering those things. So don't just make up or look on the internet. Try to think of what has happened in your medical experience regarding that scenario and tell them that answer. I think that is the best thing. Yes, that book is important. It does give you an idea of what questions are asked, but don't use the answers which are written in that. And again, the clinical governance part of that. So you will have to incorporate the principles of clinical governance in your answers. So if it is an ethical scenario, you will have to see what you have done in terms of risk management. For example, there was a drug error. You should incorporate those things into your answers. And that is what they like. So they want to know and see if you know about the working of the NHS, if you know about clinical governance, if you know about GMC's good medical practice. So this will all come in the ethical scenario. You can even use these principles while you are dealing with a clinical situation, just to impress upon them that, yes, you know the thing and you are well versed with these principles. The last scenario, fourth scenario, it was basically you either have to present a case through which you have come across in your life, or about research that is practice changing. So last time when I appeared in round 2, I did present a case. It was a good, nice case, interesting case, which I presented relating to multiple myeloma. But somehow they had scored me 3 and 4, and I had got 7 out of 10. So I thought I need to do something more, and maybe I'll try something different. So luckily, those days, a research had come up. It was a trial regarding aplastic anemia and a new treatment in that. And the trial was done in Europe. So published in January, I thought it's a new research. It is practice changing because it was a phase 3 trial. And the people who were involved from UK were leading hematology head figures from UK. So I thought that will again impress the interview that he wants to see what is happening in hematology in UK. And it worked. Again, there is a time limit for all the stations. There were, I think, 5 or 7 minutes for the presentation. So Taylor, it was a big trial, so I had to compress it and present it in a way that it was palatable to the interviewers and it fitted the time slot. So it worked. But important in that is you should know the inside out of the trial or the research. So at the end, they asked me, what do you think were the flaws in this trial? So I had to tell them what I thought was not good in this trial. And they asked me some questions like, what do you think will happen after this trial? Will there be another trial? So you should know inside out of that. Even if you are presenting a case report for that particular disease, you should be the master. So the level of knowledge they would expect in the presentation scenario will be a bit higher than what they will expect in a clinical scenario. So they will think that you have already read and researched and found out little things about that trial or about that case report. And most importantly, what they will ask you is, how do you think that this thing is going to change your practice? So you should be knowing that also. It's not that just you will pick up any case report and tell them, okay, it was rare. Rare won't help. So you should know what this case report, how this case report changed your practice. And or if I'm telling them about a trial, how it will change my future practice. So that is important in the presentation scenario. Most of the marks were for the ethical and the clinical. It contained 25 marks each. There were 12 marks to commitment to specialty, and there were 18 marks for the presentation, which I told you, the case report or research or a practice changing update. So Alhamdulillah, I dropped only 1 mark in the whole interview. They gave me full marks, except what I told you, the commitment to specialty. I think only thing lacking for me was I wasn't working in hematology here, and I hadn't done an audit. But other than that, yes, if you have prepared well, if you stick to your time, and while answering, if you stick to the GMC's principles of good medical practice and the clinical governance practice, I would recommend the video that you have done on clinical governance. That is very helpful. Like, one can go through that and understand what actually clinical governance is. In fact, I feel all of us do practice clinical governance aspects at some point in our practice, like not some point, every day. We just need to know what we are doing and to portray that in our interview. That's important. So how you will present it and how you will reflect it in the interview, that really helps and that really works.
No, thank you for. I think this is a very good, useful information you've given. Going through all the stations you faced and how you cope with them. I think it's very important. I think for IMGs to understand this commitment to specialty, I would like to say here, it's not just for hematology. Whatever specialty you are doing, if you want to do something else, sometimes IMTs are actually, or core medical trainees or people working in medicine, aiming for ST training. They are sometimes making their portfolio for two different specialties as well. So if sometimes you can't just focus all energies on one specialty. You have to think, what is my plan B, and if I'm going to apply for 2 or 3 different ones, how can I invest my time in that? So I think this is important to see. If you want to go for a specialty, just start thinking about the commitment early, and you're giving a lot of good tips. So I think you have already touched on a lot of points which I was going to ask you anyway. But as journalists, as an IMG, if somebody is working in their home country right now, or even if they are at a medical student level, I think you covered a lot of things that counts as improvement of CV. But is there any other advice you want to give them, that if they're thinking about watching this video, thinking about coming to UK, what can they be doing to improve their chances overall to do well as a doctor here?
See, Anand bhai, I'll tell you, everything is in destiny. But what I would advise, so I'm turning 40 this year. It took me a lot of time. I sometimes reflect and think, had I come earlier, I might have already been a consultant right now. So if you are thinking of move at the right time. Don't waste your time. I think the best thing is to do IMT here, because by doing IMT, you grow in the system. You come to know about the system inside out. Like when I was discussing about the interview process with my fellow colleagues who have done IMT in UK, I could definitely make out that they know things much better than me. It isn't impossible, as I told you. I had to strive a little bit more. For them, it is easy. They go into like a rotation. They place their rotation in such a way that, okay, I'm interested in hematology, I'm interested in cardiology. I'll keep my slot for 6 months here and 6 months there, and that is a big boon for them at improving commitment to specialty. For us, it's a little bit difficult, but I'll say not impossible. So what I would suggest and recommend my colleagues is, if you're planning to come to UK, definitely it's a land of opportunities. It gave me what I wanted, what I couldn't get anywhere. It's a very free country. If you are committed, they will immediately recognize that aspect, and they will help you in all possible ways in getting to your dream. But start early. Don't waste time like me. So I had some personal reasons why I couldn't come. I initially was in a dilemma whether to leave my country or not. But ultimately, I took the call and I left. And I will ask them to start early. And whatever you are doing, if you have chosen a specialty, work on that wherever you are. So I would like to tell you that I was in medicine. I was focusing on hematology. Don't neglect your own job at the cost of it. Just focus on the specialty you are doing. Do your work honestly. Yes, whatever you find, for example, if you are working in medicine and you find a patient having ITP, just try to see it, discuss with hematology colleagues, develop your interest in that. If you are working in renal, for example, you see TTP, a patient has a renal failure and you see TTP, just write about it, read about it, talk to your hematology colleagues. If you are in gynae you see a patient is having thrombocytopenia secondary to pregnancy or gestational thrombocytopenia, talk about it, speak about it to your hematology colleagues. It will definitely develop your interest. Attend conferences, join societies. So it's easy, even if you are in Pakistan or India, you can join British Society of Hematology from there. You can attend a conference from there. You can attend meets from there. So wherever you are, whatever you are doing, keep the thing in mind that you have to build your CV as per the specialty of your choice. Another thing which I found here, which I'd like to mention, I'm a bit surprised by that. I saw my colleagues applying in 4 or 5 specialties altogether. I don't know how that works. For me, I think 1 or 2 specialties, okay, choosing a primary specialty and keeping the second specialty as a backup is okay. Applying for 5 or 6 specialties, either it means that you are not sure which specialty you are interested in. I would suggest choose a specialty, work on that, and there is no doubt that you will not get it if you work honestly, sincerely. Even I will tell you, I try to convert your problems into your advantage. So my problem was I was working in acute medicine. Then I try to find out how I can make it to my advantage. So I saw that, okay, I'm getting patients, we are treating DVTs, we are putting patients on anticoagulation, we are getting patients with bleeding problems. See those cases, discuss with seniors, you will get an edge. Try to do an audit. For example, I was thinking now, because we transfuse a lot of patients in our department, I was thinking of doing an audit on blood transfusion. So try to, even if you are not in the best of situations, what I would recommend is try to make the best out of it. And try, as my friend already had said, that whenever you wake up in the morning, try to see what I can do today for increasing my score. Try to think what I will do today that will bring me closer to my specialty. So that way it works. Whether you are in subcontinent, whether you are in UK, you have to keep this thing in mind. Try to be focused. So I will tell you, I started to dream of becoming a hematologist, right? I was about 27, 28. And
Yeah.
as I told you, I'll be turning 40 now. Ultimately, it took me 13 years, but Alhamdulillah, I'm thankful to Allah. He gave me, I got it in the best hospital and best institute in UK. It might take time, but if you are committed, if you are honest, if you are sincere, it will pay off. It will definitely pay off.
So thank you for your time and giving all the advice. I'm sure this will be useful. And I will request some time again from you to discuss, especially acute medicine, which is you also secure, so you will understand the process much better. And also, I think you were working in acute medicine. That probably was a better advantage for you
Yes.
as well.
Acute medicine, like medicine, hematology was my first love, and
Yeah.
acute was the second.
Yeah.
I loved both specialties equally. Not equally, like definitely because of the personal reason I told you of my mother. Hematology is very close to my heart.
Yeah.
So whenever I see a hematology patient, it reminds me of my mother. And Yeah, acute was definitely, I wouldn't have shied from joining acute, although it has its merits, demerits. But there are ways. Again, there are dual accreditations which you can do in acute medicine. I had planned of joining IT if I would have done acute medicine. But yes, I did secure rank 7 all over UK in acute medicine as well. But to tell you frankly, when my mother was dying, I had promised her that I'll become a hematologist. So it had to be
That's a
done
personal, yeah.
somehow. And alhamdulillah, I'm sure if she would have been around, she would have been happy. But yeah, that's how life is.
So thank you very much for sharing your personal journey and all the advice.
Thank you.